Doctor, as always, thank you so much for joining us. We're glad you're here to answer some questions for us here. Doctor, we know the CDC is meeting today, as Lindsay was just talking about, to decide who's going to get that vaccine first. Right now, the estimates there are 21 million healthcare personnel, 87 million essential workers, 100 million adults with high-risk medical conditions, and, of course, millions of age 65 and older adults out there. The federal government has said 40 million doses available. That's the first number we're getting about maybe by the end of the month. That's not enough to go around quickly. So how do you make a decision like that? How do you start to parse through, okay, we've got this much vaccine, this is how many people need it, here you go. Like, how is that process made?
Yeah, I mean, there's a lot of deliberation on who is to be getting it. Of course, we want all of the essential workers to do that, and that includes healthcare workers, even people in supply chain. But just as you mentioned, those subpopulations, we want to be able to continue to be able to give healthcare. So we need our skilled workers to be able to do that. Obviously, there is that extremely vulnerable population of the nursing home people who are living there, who are at risk every day of getting it and severe outcomes. So it does get to be difficult. We don't want to ration healthcare. But again, this is just a short step to having more supply of the vaccine, and that's why it's important. And we had talked about this before. Well, what if the vaccine is 90% effective versus 94% effective? Or, wait until we see the final data from AstraZeneca. That is why you need so many companies creating supply so that you can have increased supplies of those vaccines to get out to the mass population of the United States. So that is coming. But just in these initial phases, yes, there will be a short supply. But eventually, especially by the end of January, I think, people are predicting that the companies will have a much greater supply to be able to get more vaccinations to more people.
Any update we get about that, everybody is just so keyed into. Dr. Hawkinson, a lot of people traveled and gathered for Thanksgiving despite warnings from health officials. Now we're hearing if you did travel and gather with people outside your household, you should get tested. But when? So today is 5 days after Thanksgiving, which is wild to think about in itself. Should people get tested starting today if they gathered with people outside of their bubble, or when is the best time?
Yeah, thank you for letting me know that earlier today. I mean, just as you said, time flies by with Thanksgiving and all the games and shopping. There is no good guidance, and certainly the CDC recommends getting tested if you're exposed, and now there's kind of a new recommendation of if you were gathering around people, go get tested. There's no good guidance about that. We know that most people who develop symptoms will develop symptoms within that 5 to 7 day period, and so you will have detectable virus. So really we kind of land on, well, maybe the first 5 to 7 days, or 7 to 9 days after your exposure, so that you can have an accurate test result. And if you are positive, it's positive. So today is probably the first day you really want to start to think about getting tested if you are gathering around people or exposed to somebody. Now, again, that should not negate, even if it's a negative PCR test, that shouldn't negate, really the recommendation to really try and quarantine and isolate away from others for 14 days after that exposure. But just as you said, today is 5 days. Today is probably really the first day you want to look at maybe getting tested. Should you be quarantining even if nobody at your Thanksgiving gathering that you know of had COVID-19? Should you just be staying away from people anyway? I think that's been some of the recommendations of the higher ups, Dr. Birx, Dr. Fauci, just because you don't know and don't understand. As much as you can, you really probably should be quarantining, obviously not a full isolation. And that does get difficult if you need to work. But always continue to remember to wear your mask, do your physical distancing, maybe do a symptom check twice a day. We know that for essential workers, for healthcare workers here, even after exposure, they do work, but they need to be quarantining at other times. But they do symptom checks, twice a day to make sure that they are not having new fever, new cough, or aches, or anything like that.
So on that topic about new fever, new cough, and those symptoms checks, you know, it's flu season too. And like my family is dealing with a COVID case at our house. My wife tested positive a couple of weeks ago. So now we're so keyed into, even more than we already were, any sniffle from one of my 3 children. Oh, you've got a little bit of a fever. How much of that is factoring in right now? Give us an update on flu going hand in hand with COVID and what people should be aware of on some of the symptoms. Are there differences we should watch for?
Yeah, it's hard to tell. There's not a lot of differences in the symptoms per se, but what we do know right now, luckily, in the United States, the flu activity is extremely low. There is still a lot of people presenting to, obviously, emergency departments and physicians because of influenza-like illness, and that is cough, aches, sore throat, fever, things of those. Those symptoms occur in influenza. You know, certainly you probably have more body aches in influenza than you do with other common cough and cold. But we have to remember there are other cough and colds going around too, the common cough and cold. So it is very difficult to understand what are the symptoms of COVID and what are these other symptoms. So it's important to talk with your healthcare provider. Probably right now there's more preponderance of COVID-19 in the community, so I would advise people to go get tested. But we know in the nation, influenza activity is very low, and really about a week and a half ago, out of 30-some thousand tests for influenza, there were only like 30 or 32 positive tests. So it's an extremely low amount of flu activity. Yep, and the CDC publishes that every week. So, but right now, I would think if you have symptoms and you haven't been ill with COVID recently, you probably need to isolate yourself and go get tested for COVID.
Wow.
Good advice.
Thank you, Dr. Hawkinson. Thank you very much. He joins us live every Tuesday morning here on 41 Action News Today to answer your questions. We'll be right back.